Today in this video, we're exploring 7 stroke symptoms to watch out for 1 month before it happens. You've certainly heard of a stroke, but did you know your body can give warning signs up to a month before one occurs? If you experience any of the symptoms we'll discuss, seek medical attention immediately, as they could be indicators that a stroke is imminent. Strokes can affect anyone, regardless of age, gender, or health status. In fact, cardiovascular diseases, including strokes, are on the rise globally, even among younger populations. In the United States alone, more than 795,000 people suffer a stroke each year, with nearly 159,000 fatalities. By recognizing these signs early, you can help prevent this disease and potentially save a life. Stay with us as we uncover these crucial indicators and what you can do to prevent a stroke. If you notice any of these, seek medical attention immediately. Let's dive in and discover the 7 symptoms that can occur a month before a stroke. 1. Persistently elevated blood pressure. High blood pressure is a major risk factor for strokes. When blood pressure remains elevated, it can damage blood vessels, leading to narrowing, weakening, or even rupturing. This damage can cause a hemorrhagic stroke if a blood vessel in the brain bursts, or an ischemic stroke if blood flow is obstructed. Managing hypertension through a healthy lifestyle and prescribed medications is crucial to reduce the risk of a stroke and other cardiovascular diseases. 2. Excessive fatigue. Feeling unusually tired and exhausted without any apparent reason can be a warning sign of a stroke. This excessive fatigue might be related to changes in blood flow to the brain due to a narrowing of an artery or a possible clot. Sometimes, extreme fatigue can precede a transient ischemic attack, which is a temporary disruption in the brain's blood supply. A TIA is a critical warning sign that a stroke may be on the horizon, so don't ignore it. 3. Vision problems. Sudden changes in vision, such as blurry vision, double vision, or difficulty focusing, can signal circulatory damage in the brain. These vision problems may result from a blockage in an artery supplying blood to the eye, often indicating an ischemic stroke. Take any sudden vision changes seriously and seek medical evaluation promptly. 4. Sudden and severe headache. A sudden and severe headache can be a precursor to a stroke. In an ischemic stroke, the headache occurs due to obstruction of blood flow in the brain, while in a hemorrhagic stroke, it results from increased intracranial pressure due to bleeding. Witnesses often report seeing the affected person clutch their head in pain before losing consciousness. If you experience a headache that's more severe than usual, seek immediate medical attention. 5. Numbness or weakness in body extremities. Sudden numbness or weakness, especially on one side of the body, can be a warning sign of a stroke. These symptoms may occur during a TIA, which involves temporary reduced blood flow to part of the brain. This numbness or weakness typically affects one side of the face, an arm, or a leg and should never be overlooked. Immediate medical investigation is essential. Before we get into number 6, if this video has been helpful so far, consider liking and subscribing to the channel. This will help YouTube suggest this video to people who would benefit from this medical information. And you'll receive all our educational health videos as soon as they're posted right to your inbox. Join us in sharing this information to the world. Thank you. Let's continue. 6. Speech problems. Difficulty speaking, such as slurred speech, trouble articulating words, or forming complete sentences, can indicate an impending stroke. This condition is known as aphasia, which is an impairment in understanding, formulating, and expressing speech. If you or someone you know suddenly struggles with speech, seek medical help right away. 7. Neurological problems. Individuals on the brink of a stroke may exhibit various neurological symptoms, including memory issues, loss of balance, nausea, and vomiting. These symptoms can appear days or even weeks before a stroke. It's important to remember that other conditions, such as migraines, seizures, hypoglycemia, brain tumors, anxiety attacks, and central nervous system infections, can also present similar symptoms. Always consult a qualified doctor for a thorough evaluation. Understanding the types of strokes. Ischemic stroke. This type of stroke occurs when a blood clot blocks the blood supply to a part of the brain. It can be caused by a clot that forms elsewhere in the body and travels to the brain, or by plaque buildup in the brain's arteries. Atrial fibrillation, a type of heart arrhythmia, is a common cause of ischemic strokes. Hemorrhagic stroke. This stroke happens when a blood vessel in the brain bursts, causing blood to leak into surrounding areas. The leakage increases pressure on the brain, damaging brain cells. A common cause of hemorrhagic stroke is a cerebral aneurysm, which is an abnormal dilation in a brain artery that can rupture. Preventing strokes. Preventing strokes involves managing risk factors and maintaining a healthy lifestyle. Control your blood pressure. If you have diabetes, manage your blood glucose levels. Maintain a healthy weight. Exercise regularly, at least 150 minutes per week. Eat fresh, healthy foods and avoid processed foods. Limit sugar, saturated fats, and alcohol. Quit smoking. Ensure you get adequate sleep. Control your cholesterol. Keep up with regular checkups with your cardiologist. I hope you found this video informative. If so, please give it a thumbs up and share it with your loved ones. If you're new to our channel, don't forget to subscribe and hit the notification bell so you don't miss our next video. We're curious to know, did you know about these silent signs of a stroke 1 month before it happens? Share with us in the comments below. Thank you so much for watching, and see you in the next video.